Ever wondered what women endured before modern medicine? Could you survive medieval gynecology? Number 6. The burning test. Did you know that in medieval times, doctors sometimes diagnosed female reproductive issues by setting things on fire? It's true. When faced with mysterious feminine ailments, medieval physicians would often resort to what they called the burning test. They would collect a woman's urine and set it ablaze. The color, smell, and burning pattern supposedly revealed everything from fertility problems to pregnancy. One particularly disturbing account from a 12th century medical text describes how physicians would collect a woman's menstrual blood, place it on hot coals, and observe the resulting smoke and odor. If the smoke turned black and smelled particularly foul, they believed the woman was suffering from corrupt humors in her womb. The treatment, often bloodletting or applying heated cups to the abdomen to draw out the bad humors. Medieval medicine was deeply rooted in the theory of the four humors: blood, phlegm, yellow bile, and black bile. Women were considered naturally colder and moister than men, which physicians believed made them more susceptible to gynecological problems. This fundamental misunderstanding led to treatments that seem not just ineffective but downright dangerous by today's standards. One French noblewoman's diary from the 14th century describes the agony of having her physician collect her urine daily for a week, mixing it with various herbs, and then heating the mixture while she was forced to inhale the vapors to realign her womanly humors. She wrote that she nearly fainted from the stench and developed a severe cough that lasted for months afterward. The burning test wasn't just unpleasant. It was also wildly inaccurate. Women were often misdiagnosed with conditions they didn't have, leading to unnecessary and painful treatments. Yet for centuries, this fiery diagnostic tool remained a cornerstone of women's health care. Would you submit to having your bodily fluids set on fire in the name of medicine? Number 5. Birth or death, the cesarean section. How would you feel knowing your caesarean section would likely be performed after you were already dead? In medieval times, cesarean sections were almost exclusively performed on mothers who had already died during childbirth in a desperate attempt to save the baby. The procedure was named after Julius Caesar, who was supposedly born this way, though historians now doubt this story. What's not in doubt is the gruesome reality of medieval cesareans. Without antiseptics, anesthesia, or proper surgical knowledge, these procedures were brutal affairs. A 14th century illustrated manuscript shows a deceased woman being cut open with what looks more like a butcher's knife than a surgical instrument. The text accompanying it specifies that the procedure should only be attempted when the mother has departed life, and instructs the practitioner to make a cut from the breast to the pubis, avoiding the navel. On the rare occasions when caesareans were performed on living women, the mortality rate was nearly 100%. Without antibiotics or proper wound closure techniques, infection was virtually guaranteed. Women who somehow survived the initial surgery would typically die within days from infection or internal bleeding. A rare account from a 15th century Italian physician describes attempting to save both mother and child through a cesarean. He writes of the mother's ungodly screams and how she was held down by 4 strong men while he cut into her abdomen. Both mother and child died within hours. The physician concluded that the procedure was an act against God's natural order and vowed never to attempt it again. Despite these horrors, cesarean sections were sometimes the only option when a baby couldn't be delivered naturally. Church law even mandated that if a woman died in childbirth, an attempt should be made to extract the child for baptism before it too died. Can you imagine knowing that your only surgical option carried virtually no chance of survival? For medieval women, this nightmare was reality. Number 4. The wandering womb theory. Have you ever been told your health problems were all in your head? Medieval women had it worse. They were told their problems were caused by their womb, wandering around their body. The concept of the wandering womb was not a fringe belief, but mainstream medical thinking for centuries. The theory originated with Hippocrates and Plato in ancient Greece, but persisted well into the Renaissance. These learned men believed that the uterus could physically move around inside a woman's body, causing all manner of ailments depending on where it wandered. If it moved up toward the chest, it might cause shortness of breath or heart palpitations. If it moved toward the head, it could cause headaches, melancholy, or even madness. A popular 13th century medical text, the Trotula, advised that if a woman showed signs of a wandering womb, physicians should place sweet-smelling substances near her vagina and foul-smelling ones near her nose. The logic: the womb would be attracted to the pleasant smells below and repelled by the foul odors above, thus coaxing it back to its proper position. Other treatments were even more intrusive. Some physicians recommended fumigation of the vagina with various herbs and minerals, often creating toxic vapors that caused burns and inflammation. Others prescribed physical manipulation, where practitioners would forcefully push on a woman's abdomen to guide the womb back to its proper place. Perhaps the most disturbing treatment involved placing hot pokers near a woman's feet to drive the supposedly wandering organ back up into her body. Records from a French convent infirmary described nuns suffering from hysteria, a catch-all diagnosis for female complaints believed to stem from the wandering womb, being subjected to this treatment repeatedly over the course of weeks. Women's actual experiences of pain and illness were routinely dismissed as the simple result of this fictional wandering organ. This theory conveniently explained away complex medical issues while reinforcing the belief that women were inherently unstable beings whose bodies betrayed them. Would you trust doctors who believed your organs were simply roaming around inside you? Number 3. Medial contraception and abortion. What would you do for birth control if condoms were made from animal intestines and sometimes secured with ribbon? In a time before reliable contraception, medieval women resorted to methods that were often ineffective, sometimes dangerous, and occasionally deadly. Medieval women had limited control over their reproductive lives, but that didn't stop them from trying. Herbal remedies were the most common form of contraception and abortion. Pennyroyal, tansy, mugwort, and rue were all prescribed to bring down the courses, a euphemism for inducing menstruation or abortion. These herbs are toxic in the quantities needed to affect pregnancy, and countless women were poisoned in their desperate attempts to control their fertility. A 13th century handbook written by an Italian midwife details recipes for preventing conception that included drinking the water in which a blacksmith had cooled hot metal, essentially consuming heavy metal toxins, and wearing amulets made from cat testicles or weasel bones. Some physicians recommended that women jump backwards 7 times after intercourse to dislodge any seed, while others suggested inserting wool soaked in vinegar, cedar oil, or even honey into the vagina as a barrier method. For those who did become pregnant unwantedly, the options were even more dangerous. Medieval texts described concoctions of hellebore, which causes violent vomiting, ergot, which stimulates uterine contractions but can also cause gangrene, and various poisonous minerals intended to induce abortion. Many women died from these treatments, whether from poisoning, hemorrhage, or infection. Physical methods were just as risky. Some midwives specialized in using sharp implements to terminate pregnancies, a procedure with no anesthesia, no antibiotics, and often performed in secret. Court records from 14th century England document the trial of a woman accused of helping terminate pregnancies using a stick of hazelwood inserted into the womb. Both she and her patient died from the resulting infections. Perhaps most disturbing were the religious and legal consequences. Abortion after quickening, when fetal movement could be felt, was considered homicide in many medieval jurisdictions. Women caught attempting to end pregnancies could face execution. Yet, desperation drove many to take these risks rather than bear another child they couldn't feed or that threatened their health. Would you risk your life for reproductive control? Number 2, the torturous tools of the trade. Ever seen rusty garden tools and thought they looked like medical instruments? Medieval gynecological tools weren't far off. Before the days of sterilization and specialized medical equipment, the implements used to examine and treat women's reproductive issues were crude, painful, and often dangerous. The speculum, a device used to open the vaginal canal for examination, existed in medieval times but in a far more primitive form than today's plastic or metal versions. Medieval specula were typically made of brass, iron, or even wood, with rough edges that could cause tears and abrasions. They were opened using a screw mechanism that could easily pinch delicate tissues. Worse still, these instruments were rarely cleaned between patients, making them perfect vectors for infection. A 14th century French surgical text describes a procedure for removing a dead fetus using a tool called a crochet, essentially a large, sharp hook. The surgeon would blindly insert this hook into the woman's womb, attempt to snag the fetus, and then pull it out piece by piece. The text matter of factly notes that the woman should be held down by strong assistance, for she will struggle greatly from the pain. For difficult births, medieval midwives and surgeons used forceps-like instruments that could crush the baby's skull to facilitate delivery. A procedure performed when the mother's life was pronatized, or when the baby was already believed to be dead. These craniotomy tools included sharp scissors, hooks, and cranioclasts designed to break and extract the skull bones. The procedures were performed without anesthesia on fully conscious women. A particularly horrifying account comes from a 15th century Italian physician who described using a speculum magnum, great speculum, to dilate a woman's cervix, followed by a series of increasingly large rods to force it open further. The goal was to extract what he called a mole of the womb, likely a fibroid, tumor, or molar pregnancy. The woman died 3 days later of what was almost certainly massive infection. Even routine examinations could be excruciating. Without proper lighting, physicians often relied on touch alone, inserting ungloved fingers into women's bodies. One medical text advised physicians to cut their fingernails short, but said nothing about washing hands between patients. The concept of germs was centuries away from being understood. Can you imagine enduring these procedures without anesthesia or even the comfort of knowing they were being performed with clean instruments? Number 1. The mystery of menstruation. Did you know medieval doctors believed menstrual blood could kill crops, rust iron, and drive dogs mad? The natural process of menstruation was perhaps the most misunderstood aspect of women's health in the medieval period, shrouded in superstition, fear, and elaborate misconceptions. Medieval medical authorities, drawing largely on ancient Greek and Roman texts, described menstrual blood as impure, venomous, and excess matter that the female body needed to expel. The 13th century physician Albertus Magnus claimed that if a menstruating woman looked into a mirror, she would leave bloody spots on the glass. Another medical text warned that sexual intercourse during menstruation would produce leprous, deformed children. These beliefs weren't just harmless superstitions. They had real consequences for women's medical treatment and social status. Women experiencing menstrual problems were often treated with extreme measures. Heavy bleeding might be addressed by applying heated cups to draw blood to different parts of the body, while absent periods could be treated by bloodletting elsewhere to balance the humors. The social implications were equally severe. Menstruating women were barred from certain religious ceremonies, food preparation, and even physical proximity to men in some cultures. A 14th century English manor record describes a female servant being dismissed without reference because she was discovered to be menstruating while preparing food for a feast. For those with irregular cycles, which could be caused by anything from nutritional deficiencies to hormone disorders, the consequences could be dire. Women who didn't menstruate regularly were sometimes accused of being pregnant out of wedlock, or conversely, of being infertile, and thus less valuable as wives. Some were even suspected of witchcraft, as controlling menstruation was associated with magical abilities. The treatments for menstrual disorders ranged from the benign to the bizarre. Herbal remedies included drinking pennyroyal tea, hepat toshep in large doses, or applying poultices of nightshade, potentially poisonous to the abdomen. Some physicians recommended sitting over steaming pots of herbs, wearing special amulets, or even consuming the burned ashes of toads to regulate menstrual flow. A particularly disturbing account from a 15th century German midwife describes treating a young woman with absent periods by having her drink her own urine mixed with wine for 7 consecutive days. When this failed to produce menstruation, the girl was diagnosed with a closed womb and subjected to painful manual attempts to open her cervix using metal dilators. The mystery surrounding menstruation contributed to women's overall medical mistreatment. Without understanding this natural process, how could medieval practitioners possibly provide appropriate care for more complex gynecological issues? Would you want to live in a time when a natural bodily function marked you as potentially dangerous, dirty, or diseased? What would you have done if these were your only healthcare options? How many women suffered silently rather than face these brutal treatments?